Okay, so we're going to go ahead and take a look at some of the muscles we're responsible for being able to identify here. And we will start with the sternocleidomastoid muscle. Make sure that you are identifying the origins and insertions here using the reference sheet. The pectoralis major. Pectoralis major is going to have multiple heads within it. It's a convergent muscle. There is not an upper, middle, and lower pec as most of the people in the gym might tell you. It is a single continuous muscle. There are distinct heads to it. However, there is not separate muscles within the human. Deep to pectoralis major, we will have pectoralis minor. Pectoralis minor is one of the muscles that when you do too much pressing activities or have poor posture leads to a hyperkyphotic positioning of the upper extremities. We have the trapezius muscles. The deltoid muscles. And we have three distinct deltoid muscles within there. We have the anterior and middle head of the deltoids that we can see here, as well as the posterior head that we'll see in a little while. We have biceps brachii, which remember is that we have to identify that this is the biceps brachii and not just the biceps, because you actually have 4 biceps muscles. Then we get to the rectus abdominis. The rectus abdominis will have its multiple tendinous insertions within the muscle as well as the abdominal sheath that overlays it. That's the white matter that you see. And then we get to the internal and external abdominal obliques. Once again, you got to make sure that you are indicating that we are looking at abdominal obliques because there are different oblique muscles, because once again, it's a naming thing. Notice the patterning of the muscle that we see within the internal and external abdominal obliques. You can indicate which muscle we're looking at based off of its angulation of muscle, and they actually head in different patterns. Then we get to looking at muscles of the face. We get to the frontalis, orbicularis oculi, orbicularis oris, and then we get some of the other muscles that are going to be responsible for moving the mouth, such as the zygomaticus muscles, the major and the minor. So we've turned our viewpoint just a little bit here, and we have rectus abdominis. Pectoralis minor. Pectoralis major. Biceps brachii. The sternocleidomastoid. Orbicularis oculi. The masseter muscle. The buccinator. Frontalis. And once again, the zygomaticus muscles. And once again, we have turned our viewpoint here slightly. And we have the trapezius muscles, serratus anterior, the external abdominal oblique, the deltoid muscle. In this case here, we can actually see all three of the deltoid muscles, the anterior, middle, and posterior. Sternocleidomastoid again. Deep to sternocleidomastoid and anterior to the trapezius muscle, you can see the scalenes, as well as the longissimus cervicis muscles. And we have pectoralis major. Here you get a little better view of the various angulations of the pectoralis muscles. Once again, we do not have different muscles. This is a convergent muscle where it may appear like we have different muscles together. However, because it's a convergent muscle, it is one continuous muscle that we have for the pectoralis muscle, for the pectoralis major. And deep to pectoralis major, we will have pectoralis minor.